Hello world, I am Jenna Perkins. I am delighted to be a nurse practitioner here at the George Washington Medical Faculty Associates, and I am here with my colleague, Dr. Sherelle Carter-Brooks. And we are so excited to talk to you about the work that we are doing within the Urology and Gynecology departments here at the MFA.
So like Jenna said, my name is Dr. Carter-Brooks, and I have been at the MFA for 2 years now. I did my training in obstetrics and gynecology here in DC, and then did my fellowship at Magee Women's Hospital, UPMC in Pittsburgh, and I'm so happy to be here. We haven't had a urogynecologist in a very, very long time, and so there was a huge kind of deficit in care, which Jenna was filling, but in terms of more advanced evaluation and procedures, we needed someone to be able to offer that. And I think women in DC, there was a need to see them. And so pelvic floor disorders, to get into that, are a group of conditions which affect women. They include urinary incontinence, which is leaking of urine involuntarily, so when you don't want it to happen. Pelvic organ prolapse, which is basically when the pelvic contents herniate through the vagina, creating a bulge that can be uncomfortable, sometimes painful, prevent activity. And then there's also fecal incontinence, where you can't hold your bowels. There's also more general urinary symptoms like going to the bathroom too often, having a strong urge to go to the bathroom that you can't control, and waking up at night to go to the bathroom. Those constellation of symptoms make up pelvic floor disorders, and that's mainly what I see women for. These conditions are very, very common. So 1 in 4 women, that's 25%, will have one of these issues, and many of them will have more than one. Risk factors for these conditions include childbirth, age, obesity, genetics, and many other things that we don't even think about. And so we're here to help women who have these conditions and give you a comprehensive treatment plan, make sure we do a thorough evaluation, and be able to offer you the most modern treatments that are out there to help you manage your symptoms.
Yeah, so I have been lucky enough to be here at the MFA for the last 6 years. So starting in 2014, I got both my undergrad and master's degrees from the University of Pennsylvania, and left Philadelphia to follow my dreams of being here in DC. And I was alone, kind of on a ship by myself, caring for the women who were suffering from these very embarrassing and life-changing conditions. And so I'm so happy to now have a partner here who can offer surgical expertise in addition to the healthcare management and medications and prevention that I've been able to offer for the last 6 years here. So I think we make a pretty good team, and it's kind of a one-stop shop for everything from bladder, vagina, and bowels. You know, if it's anything that is happening down there, we are your team for, and I think we do a pretty good job.
And Jen, are there any conditions that I didn't mention that you are helping women with currently?
Yeah, so one of my passions that have grown out of my experience here is actually helping women with sexual function and sexual dysfunction. So pelvic pain is something that is grossly ignored in the medical world, and it is something that I'm very excited to be able to offer to the women of the Metro DC area. We have lots of options that aren't always surgery. We have lots of things that we can do before you might be referred to Dr. Carter-Brooks or another surgeon. So I'm happy to evaluate women and be able to get you a really good care plan and really help to start the healing process, which is very important.
I think one of the nice things about the sexual medicine that Jenna does is she's able to offer a lot of those initial consultations via telemedicine, if not in the office, which can be a little bit more convenient for women, and is also very private and can also take away some of the anxiety about going to see a provider for the first time, or even if you see multiple providers with these issues.
Mm-hmm.
I think other things that are well suited for some of these initial consultations are also initial urinary symptoms that have not been evaluated before. So as you mentioned, the urgency, frequency, leaking of urination. Mm-hmm. Another thing that we treat women for are postpartum pelvic floor issues, which are very, very common and probably grossly undertreated as well, including perineal pain, pelvic pain, vaginal dryness, pelvic floor weakness, prolapse, leakage, all of those things which can happen very early on after childbirth, which nobody tells you about. Both Jenna and I are mothers, so we have some firsthand experience with this, yes. And so, being in the health field ourselves, we've realized how much information is lacking out there for women. So we also specialize in that care, and that can be a great, initial telehealth visit or come into the office depending on how you're feeling.
Yeah, I think telehealth is great at just being able to get the conversation started. And even if you do need to come in for a visit, it can really help to give us time to be able to talk about these very intimate things. And so you don't have to feel like you need to be rushed through a 10-minute visit, which oftentimes happens in the clinic, where we can really sit down and get to know each other and really connect about your experience and figure out what the next steps are.
I think another thing that makes our department and our program unique is that we are situated both in the OBGYN department and the urology department. Mm-hmm. So we have colleagues on both sides who can help us with management and evaluation if some of your problems maybe fall outside of what we're specifically doing. So as Jenna mentioned, the pelvic pain, but if there's an endometriosis component or a heavy vaginal bleeding, fibroids component, or if there's kidney stones or blood in the urine, things like that, we can kind of work with our colleagues with. In addition, we work very closely with the colorectal surgeons for issues like fecal incontinence, rectal prolapse, severe constipation. We have pelvic floor physical therapists at GW that we work with. We also work with those out in the community as well. Pelvic floor physical therapy is a really important part of management for a lot of the conditions that we treat here. And so our approach is really a comprehensive nature. We even have sex counselors that we work with. We have psychiatrists that specialize in just women's health issues that we refer patients to. So overall, I think our mission and our passion is really being able to connect women to the resources that they need in terms of a comprehensive care picture.
Yeah, it is really nice to be able to be a bridge, especially when we know that these conditions don't happen in silos. You don't just have one of these things. If you have pain, then you usually also will have some sort of other components that are going along with it. And it's really nice to be able to come in or to sit in your living room and see providers who know that that is the truth and who can offer you resources from all of these different arenas, because you are a body and everything is connected, and you should feel that when you're getting your care.
I agree.
Yeah. So
perfect. Come in and see us. We're looking forward to it.
Yeah.